The respiratory therapy curriculum prepares individuals to function as respiratory therapists through demonstrated competence in the cognitive, psychomotor, and affective learning domains of respiratory care practice. Graduates perform diagnostic and therapeutic procedures with exposure to current and emerging practice settings. The curriculum prepares graduates to operate within interprofessional teams and effectively communicate with clients, patients of various ages, ethnicities, and cultures. Application of problem-solving strategies, applying ethical decision-making, and understanding professional responsibilities are emphasized. Graduates are eligible to complete the credentialing process through the National Board for Respiratory Care, which will qualify them for a license to practice in a variety of healthcare settings, with responsibilities for assessment, treatment, management, and education of patients with cardiopulmonary diseases.
Now, RCC has a wonderful program. Our program is 2 years in length. We go to 13 different clinical sites. So our patients have a wide variety of different sites, what they get to see, what they get to do and experience. Also, it's very affordable, and it just makes sense. We have a very good relationship with UNC Charlotte and many other universities. So once a student comes to us and gets their associate's degree in respiratory therapy, if they're interested in continuing education and getting their bachelor's, we have a very good relationship. Then they can move on and work on their bachelor's online as they're working. Respiratory therapy is a very concentrated profession. We focus mainly on the patient's heart and lungs, mainly on the breathing. We do, of course, focus on the whole body because every area of the body needs oxygen to live. So we focus mainly trying to keep the heart healthy and the lungs healthy, being as those two go hand in hand. We work with many types of diseases like asthma, COPD, sleep apnea, anything concerning breathing, as well as any kind of cardiac issues. With a respiratory therapy degree, there is a vast amount of jobs you can work in. Of course, the main one is the hospitals. In the hospitals, respiratory therapists are the ones they call anytime a patient's coding or crashing. That's hospital language for patients who are not doing well or dying. They will call respiratory therapy. So what we do there is we intubate. Of course, we do CPR. The airway is our main focus. So we intubate, we place the patients on ventilators, and we manage the ventilators. We do draw blood. A lot of people think we do not, but we deal with blood. We draw from the arteries. I know phlebotomy and nurses usually get blood from the veins, but what that tells us is the patient's oxygenation status, or they're able to blow off the CO2 like they're supposed to, the pH of the blood. That helps us manage ventilators. So, of course, hospital is our main avenue that we work. However, we can work in physicians' offices doing pulmonary function testing. We work in the NICUs with the neonates and the preemies. We can work in cardiac rehab, pulmonary rehab. We work in sleep labs, transport. A lot of transport teams require that they have a respiratory therapist on board. So concerning flight transport or whether it be ground transport, they need most of the time a respiratory therapist on that team as well. The field of respiratory therapy, especially in our state, is really, I've just got back from a state meeting this past week, are really getting innovative on increasing the field of respiratory therapy. So they're encouraging to go as high as you can with your education in respiratory therapy, and they're actually, UNC Charlotte's actually working on a Master's of Respiratory Therapy program as well. So they're really pushing education. So once our students obtain their associates and become working therapists, we do encourage them to keep on going.
For more information, visit us on the web at www.rockinghamcc.edu/admissions/information-respiratory-therapy.